Well, I'm going to introduce myself. My name is Flannery Fielding. My pronouns are she and hers, or her. And I'm a nurse practitioner working with the amazing Dr. Gupta. And my role is to help guide folks through their process. And so today we'll talk about the consultation process.
Flannery, let's think of a patient or their family member who are who are far along enough the entire process that they know they want bottom surgery. Mm-hmm. And they've been on hormones and they are out living as their appropriate congruent gender role, and they want to talk about getting a surgery done. So walk us through how that entire process works.
Sure. Well, there are a few different ways that people can get in touch with us and access our program. Some people will begin by reaching out to our LGBTQ and gender care program director, Christina Reed, or they will call around. They may have heard from other folks that we exist and that we do good work. Either way, it begins with the initial visit with us, often with me to begin with, although we always try and make sure that they meet you while they're there, to find out a little bit more about that person, about you. So where are you at in your journey? What are your goals? What are you hoping for from surgery? And then based on that, then we can talk about, well, this is what we can offer to help you get to those goals. So you'll usually have about an hour at our first visit to kind of talk through all of that, talk about the various options, talk about the requirements. So in terms of requirements for bottom surgery, the guidelines that we follow are the WPATH guidelines. A lot of people have heard of those. There are some new guidelines that have come out, but we're still going with the last set of guidelines until insurance catches up. Basically, the requirements say that you need to have been on hormone therapy for at least a year and living in your gender congruent role for at least a year. We also want to make sure that you have good social support, that you have people around you who are supportive of your transition, supportive of the process, especially when it comes to surgery, because you've talked about how complicated and significant these surgeries can be. We really want to make sure that once you're out of the hospital, that you have people to support you and to help take care of you. So we'll definitely spend time talking about that and making sure that you understand kind of what is involved in terms of the time that you'll be away from work. We also really want to make sure that if there are any other issues that you have, especially medical issues like diabetes or lifestyle things like cigarette smoking, any type of nicotine, that we address those in that first consult because they have such a huge impact on the surgical outcome in terms of some of the complications that you can have, in terms of your healing, your recovery, and your overall result from the surgery. So that's something that we'll spend some time talking about and making sure that if you have one of these other issues or one of these other components, that we have a plan to address that.
If someone comes in and says, hey, I want this kind of surgery, and they're a great candidate, can you just go ahead and pick out a surgery date for them? How does...
I wish we could. I know our patients would like that too. Yeah. Because once you're finally at the visit with me and meeting Dr. Gupta and I for the first time, we do require 2 letters of mental health support from a mental health provider, from 2 separate mental health providers. Once we have those in hand, and you can certainly bring them to your first appointment, then we can make sure that we have a date picked out for surgery. And generally there is a period of several months or longer before we're able to book that surgery, from the time that we meet you to the time that you actually get surgery.
I mean, I always worry about, if there is such a huge lead time between visit and finalization of surgery and the surgery itself, whether there is, there's a lot of there's a loss of connection there, and so what are the mechanisms that are in place? Do you do anything? Do we do anything to try and minimize that leading up to the surgery and things like that?
Absolutely, especially understanding that when you visit with us, we just have an hour. It's not uncommon that questions come up after the fact. Life happens, and so we absolutely make sure that we are in contact with you over the period of time when we first meet you to the time that we set the surgical date to the time that you actually get surgery. So that is where the rest of our team comes in. We have some wonderful people who are working both up front line and behind the scenes to make sure that any issues with insurance are dealt with, that we have everything set for your surgery to go smoothly. And we absolutely have people that you can reach out to and who will reach out to you to check in and make sure that we have all the up-to-date information that we need from you, and that you are able to connect with us and ask the questions that somehow slipped your mind during our visit, or if there's something new that's going on in your life that we know about that, and we encourage folks to reach out to us and let us know where things are at, because life happens and things change.
Tell us a little bit about, I don't know whether it's too much of a granular detail, but say a patient has a vaginoplasty scheduled 2 weeks from now. So leading up to it, what are the supplies, what is the prep, what are the social things, what are the accommodation things that they have to think of?
Yeah, absolutely. Everybody who has a surgery scheduled, regardless of what type of bottom surgery that we're doing, will see me 2 weeks ahead of their surgery. Our clinical nurse navigator, Angel, will be in touch with folks by phone to talk about what they can expect in the hospital, what our visitor policy is that week, and then make sure that they're set up to see us, and looking forward after surgery, make sure that there are follow-up visits already scheduled. We also have a patient education website that is evolving, that has more information about what you might need, what type of supplies, what are some of the things that are needed going into surgery. We haven't talked